Yes.
Okay, I'd like to call the Ways and Means meeting to order if I can. Present myself, Elaine Daly, Heidi Nightingale, Bob Shea, Ben Vitale, and Tom Winslow. We should start with the pledge of allegiance. Oh, it's Mari Tate. No, the pledge of allegiance to the flag of the United States of America, and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. I have no appointments on the agenda. Oh, I'd like to get a motion to approve the minutes of June 17th.
I'll move. Second.
Any questions? All in favor?
Aye.
As you see, there are no appointments on the agenda for tonight. And since we don't have a significant number of presentations, I may save the budget presentations up till after we get through the resolutions, and then people who don't have to stay to participate in that certainly won't have to. And Grace reminded me last time we did this, I didn't even pay attention to the other departments. So we won't do that this time. So if we could start with the treasurer to see if he has anything to add to his report.
No, not really yet. If you have any questions.
Ben?
Can we still pay the bills?
Yes,
Okay, thanks.
Why? Is there a worry we couldn't?
as of what time?
Oh.
The larger question there is, we have a significant financial issue that we already all know about for the year. And there's a number of things that are gonna have to be dealt with in the budget this year, to be successful going forward. And there's a lot that goes into that, but you've mentioned it in the last couple of meetings. And I want to add my voice to the fact that things that most of us already know is it's going to be a very difficult year with a lot of difficult changes. So that's what we have ahead.
I see what you were referring to, cash flow and paying the bills. Grace, you have your report here, and I think you are going to speak a little bit tonight on some topics that would be related to the budget. So if you want to go, you can do it now, or you can wait till we have the budget presentations.
I can wait. That's
Okay. Is there anything that you want to highlight in your report?
I just wanted to say that the finance department has successfully moved. As you can see on my report, we are now located at Community College. It was a pretty seamless transition. So I do want to give a shout out to IT, purchasing, Shireen, buildings and grounds. They really helped a lot to get us, or help us out a lot to get us over there in a matter of a few hours, and we were up and running. So just want to do a shout out to them.
Did you say to me, or did I hear you say Malecki is going to be coming to do the audit report for?
Yes, I was going to mention that later, but yes.
Okay.
So we are doing an exit interview with them this week, and then they are planning on presenting to the full edge on next Thursday.
The results of the 24 audit
24
and the audited fund balance amount?
Correct. Yep.
Okay. Jennifer Delicato is not, she's on vacation, so she's present tonight. She does have a few resolutions that, I can just go through when we do the Ways and Means agenda. Diane?
Hi, I'll just ask if anyone has any questions about my report.
Just a comment that it appears that even though it's just one or two positions, we continue to go down in open positions. We're at 29, we were at 31.
Yeah, we did have a few prior to the hiring freeze going into effect that had approved resolutions, so a couple of those have been filled recently. So.
And I believe you are going to be having some kind of preliminary meeting with Jonathan on the HAP study and just gonna get a sense of where it is before it comes forward to the legislature, or
Yes, that's correct. Yep.
Okay, and that was the plan all along, that in September, October, there'd be some kind of preliminary report and the possibility of some of the realignments into the 2026 budget.
Right.
Okay, and that's,
Yeah,
okay, thank you.
you're welcome.
Amanda?
I don't really have anything to add, just to note that I put in there that I'm working on transitioning the buildings and grounds, projects, contracts, things like that over to Kevin, the new superintendent of buildings and grounds. That's going well. We're meeting again tomorrow, giving detailed information on all past, current, future projects that were listed from Gary with Tony to me, as well as contracts and things like that, and things that we've tried to centralize to save money, and also highlighting some opportunities that he could potentially look into also centralizing and saving. But if anybody had any other questions.
Any questions? No? Thank you.
Thanks.
Okay. Ways and Means has 3 resolutions tonight. How well I can speak to them, but the Ways and Means one is the authorizing the settlement of Nucor Steel, Inc. They challenged their assessment and all parties have agreed to the settlement. The assessment results in a reduction of over $7 million from their original assessment. I think it is Jenny's opinion to go ahead and support that settlement. Let me go right through. Ways and Means 2 is to authorize the purchase of tax foreclosed property owned by Cayuga County. And there is a offer made by a previous owner and for $11,075. And she's recommending to go ahead and pursue that sale. The last is sort of an annual standard resolution that allocates insurance costs to departments that receive reimbursement. So these costs are embedded into each of the departments so they can go ahead and claim for state and federal funds. I'd like to put together Ways 1, 2, and 3, unless anyone wants any of them separated.
Separate out one.
Okay. And can we bundle Ways and Means 2 and 3?
I'll move the bundle 2 and 3.
Second.
Okay, any questions? All in favor?
Aye.
Okay. Ways and Means 1 is that, okay, I'll second for discussion.
Question, maybe Fred can answer better than anybody else, I don't know. So the $7 million in reduction, that's not all county taxes though, is it?
That's correct.
It's all county taxes
What's county, school, and
and
city?
city.
Into school.
Does that include the 2025 tax period, or is that moving
does.
forward to 26?
It does not. It's 22, 23, and 24. New course filed a new petition for 25, and that's going to work its way through. the process.
So when this money is lost between all the groups, it just comes out of our fund balance, correct?
It gets reallocated among the other taxpayers in the
But
county.
you can't reallocate taxes from 3 years ago.
You cannot. I don't believe there are any refunds, so I think this was settled without refund.
Oh, without refunds, okay.
I'm sorry, the 2024 reduced assessment will result in pilot refunds not to exceed $30,000. I stand correct.
It's a pilot refund then?
That's correct.
All right, thank you.
And that makes it somewhat different. This is a
Well-
pilot in lieu of taxes, so I guess I'm curious.
Makes it a little bit different, but not a.
Yeah, not a lot.
Okay. But the loss of 30,000 will be spread those 3 parties.
I'll lose.
Can you hear me?
Yes.
I'm sorry, I am on.
Jennifer, I didn't think you were going to even be on. I'm sorry.
I was actually in a training, so we got done. I am driving back, but I pulled over so that I could talk. But essentially the pilot, the first year that they filed a petition against their assessment, it was a level amount in the pilot. So really that is discontinued. There's nothing that they can get on that. For the second year, they were waiving refunds. So refunds would be for the 24 assessment, 25 county taxes. but it would be what was paid through it would be through the pilot. So it would just be refunds for 1 year.
Thank you.
You're welcome.
Any other questions? Okay, all in favor of WM1
With no options.
with no,
Right.
that's right. Okay. Do I have to talk about the ledge? There is a ledge resolution on the agenda as well. That's coming up, set the public hearing for next week, which is to update the local law and add the language on short-term rentals. And it also makes a recommendation to change the disbursement of the 95% that's not, that's currently going to our tourism office to, I believe, have 75% of that go to the tourism office and 20% allowed to be used by the county to offset county expenses regarding tourism. That's pretty much fair.
That's pretty much fair, yes. It's paragraph 12 of the local law.
And
Paragraph 12.
we are,
Move it to, for discussion.
There's a first and a second. Yep. Okay.
Madam Chair, may I?
Yes.
So, by moving the local law forward in this motion, in this resolution, we are also agreeing to reduce the county tourism's share of the money they've already, the 95% they've always taken in from the bed tax, et cetera.
Yeah.
But we also heard from Mr. Dempsey that 80% of these new sort of properties, Verbos and Airbnbs, et cetera, have already complied and are part of this taxing system. So, you know, why would we change that 95%?
I guess I'll just jump in. There was some discussion as a way of, there were a number of other counties that do not pass through all the funds to their tourism office. They have a set of funds that they can use for tourism related services. I think, Heidi, there was a sense that this money, the occupancy tax, has moved within 5 or 6 years from $600,000 to $1.2 million. And we did meet with Karen Cool and again, told her that there was going to be discussion about changing the disbursement so that potentially we could keep a portion to offset the costs for the operation of this museum or funds at Emerson Park. She did tell me at that point, I'm sure she wasn't thrilled, but they do have a $500,000 reserve. And that if there is going to be some increase in occupancy tax from capturing whatever the 10% we don't have, then, you know, that would still leave them $900,000 annually to operate their budget and would give the county some relief on the costs that they're paying. That was really the sense behind all of this.
Can I follow up then and
Sure.
say, can we be sure and all of us be diligent when we look at the 2026 budget, that indeed that extra money just doesn't get embedded somewhere, but goes to the Ag Museum and goes to our parks?
And I think legally we would be at fault if we couldn't just take it into the general fund and use it for roads.
That's my
You know,
concern.
I know when we looked at the budget last year, we're paying $220,000 in staffing costs for the Egg Museum alone. We have costs at Emerson Park, there's Sterling Nature Center. So yes, it would have to certainly be tourism related expenses.
Madam Chair, if you look at the bottom of paragraph 12, I'm not sure what page, it indicates that 20% would be utilized by the county for quote, historic development and cultural programs, parks and recreation, beautification, and maintenance of facilities, infrastructure, and capital improvements necessary to support these services, as well as support for general government services such as public safety and for the administration and collection costs of the occupancy task. So the local law proposal is very specific as far as the categories for which that 50% could be used. I don't know if that helps or hurts, but
The last half of that sentence didn't sound like it was, sounded more like it was for general purposes.
Right, can I,
If I'm not mistaken, you took some of this language.
and Mr. Vitale is right,
Yeah.
as well as support for general government services,
such
such as
as
public safety and for
That means
administration.
anything.
Excuse me?
That means anything.
Yes,
general government service?
It's not what she's arguing.
I just want to make sure that
Okay, yep.
it can always be amended if that's what the.
So is this the time when we can amend it, or do we wait for full lead?
You could either amend it here or you could amend it at the full legislature next week. Remember, this resolution just sets the date and time of the public
Right.
hearing. The public hearing will be in August.
But yeah, I think you're right, Heidi. There's no intent to spend this on public safety.
So I think we need to eliminate that.
It's related to the occupancy tax, but yes,
So I think it's imperative to strike that, the wording of general government services such as, say, public safety
support those services,
and the
period.
administration and collection.
Forget the is.
So cut it off at to support those services and then delete the rest. Is that what you're suggesting?
Yes,
You're making a motion?
I am making a motion to amend.
For discussion? I'm sorry, is there a second? Sorry, Madam Chair.
I'll second that for clarity.
Now it's your turn to say any discussion.
Does the attorney want, no.
I'll be happy to jump in.
Did you have something?
Well, I just wanted to say, wouldn't that include, we're having concerts over here now. And wouldn't there be security as part of those concerts? Do we want to limit ourselves? I mean, we've pretty much earmarked what it's going to be used for, but if we handcuff ourselves too much,
But I think the sheriff is on, and maybe he can speak to his budget and how it is utilized for events outside of road patrol.
Hi there.
Hi.
So we have provided some security for some of the concerts in the past, but recently I did speak to Doug about this. I told him because of our pressures on our budget that we were going to quit assigning somebody to the concerts, but we would have somebody if they're on patrol and free in the central post that can stop by and walk through them. They do. So, and I don't, knock on wood, I don't think they've had a lot of issues there. So rather than assigning somebody just to be there on overtime, we haven't been doing that recently. And I'm not really sure that there's a need. Doug could maybe speak to that too, but I think just stopping by and taking a walk through there with somebody that's on, their assigned post is sufficient. I don't think we need to assign somebody there on overtime.
So Sheriff, you don't think that the park's paying any security kind of services for those concerts?
What? I'm sorry, I didn't hear you, Elaine.
I mean, they're not paying for security for the concerts that are held at Emerson Park, to your knowledge.
Correct. No, we were taking that just from our overtime budget.
Yeah.
But
Okay.
again, we've ceased doing that just because of the strain on our budget.
And if there was an incident, then of course, the police could be called.
Correct. And we still will encourage our people when they're free just to take a walk through there, during a concert, just to have a presence if they can.
Well, I'll wait for, my discussion's on the general. Let's wait for the vote on the amendment first.
Do you have something, Mark? All right, go ahead.
I've heard you mention 75% and 20%. I heard Heidi mention 95%. Where's the other 5%?
The other five's always been kept by the treasurer's office to cover the administration of the occupancy tax, and they've always had 4%, right? 5%?
5%.
It's also mentioned in section 12 of this resolution.
Yep,
You can track a number, that's all.
yep. So the amendments
Madam
on,
Chair, if I can, real quick, just to reiterate what Heidi said, these funds are not unrestricted. They're specifically outlined to be used for purposes that involve, tourism-related expenses. So the thought process with this as part of the budget presentation was to, again, we're up to $1.2 million, capture some of this revenue to use to offset existing expenditures like the Ag Museum, like Emerson Park, our tourism-related expenses, not to spend new dollars, but to offset existing expenses that we have related to those costs that we're already spending money on. So Heidi, you are correct. These dollars are restricted and need to be used for specific purposes related to tourism. Specifically, I was thinking the Farm Museum and some of the Emerson Park costs.
Thank you.
so we have a first and a second for the amendment.
Yeah.
Right, we've discussed, so
Who's in favor of the amendment and removing that last sentence?
aye.
Okay. For now, the amendment passes, yeah. And then,
Yeah, I guess I don't have a problem with it going to public hearing. My issue is, well, I guess a question, I don't know if anybody has the answer right now, is what kind of money would this recover for the county? And, you know, I don't know if it's significant, if it's a large amount or not or whatever, but it would be nice to know, have an idea how much money this might generate for the county. But the other issue that I do have is that I don't like doing this kind of budgeting piecemeal, one thing at a time. To me, this feels like I'm negotiating with the union. And the union says, I got these 8 issues and you got 6 issues. Let's take one at a time. And then when, you know, you agree to one and then you can't agree on another one, you know, you go back and forth, you don't get anywhere. I would much rather see this as a package, part of a package that, you know, so, you know, through this process, there's going to have to be some give and take. And it's really hard to have give and take when you're doing onesies and twosies. That's my only issue, but I don't have a problem with it going to the public hearing.
and if I'm not mistaken, this change in distribution does not happen until January 1st of 2026.
That's correct.
Okay. I think it's, you know, to me, it was just an opportunity. We were going to have to amend the local law anyway. And now would be the time to take a look at any way that we could increase revenue for the county, but that was the intent. Okay. All in favor of moving this to a public hearing?
Aye.
Aye. Any opposed? All right, now, Heidi, we can go through those resolutions on the agenda, not all that many, and then we'll get to the budget presentations.
Great. Madam Chair, Health and Human Services had 4 resolutions, all of which passed unanimously through the committee. Resolution number 1 authorizes the Commissioner of Social Services to fill a social services attorney. And resolution HH2 authorizes the creation, the word create is because we needed to change the title of caseworker to help program caseworker. But 6 social services caseworkers in the Department of Social Services. So I'd like to propose a bundle of HH1 and HH2.
I'll move the bundle.
I'll second.
Any questions? All in favor?
Aye.
Aye. HH3 authorizes the chair and public health to contract with city BOCES. They are essentially the only service around for audiological service for children who are eligible for the 3 to 5 preschool special education services. This is a mandate we have to provide this kind of audiological services when needed. I think that at the time of the report, Ms. Cuddy noted that this is not often used, but she believes there's one child in need right now or in the queue. So it allows us to contract with city BOCES.
I'll move HH3.
I'll second.
All in favor?
Aye.
HH4 authorizes public health to accept dual settlement funds. The Attorney General's office has given the county just under $400,000 over 8 years. We'll get 3 of those payments, which are in the range of $41,000 per year in a bulk amount, 3 years ahead all at once. The intent of the services is to educate, to reduce the use of juveniles using the vaping cigarettes or equipment, whatever that is. At the time of discussion, and maybe there's more information now, Ms. Cuddy was waiting for the state to give very definitive ways in which the money could be used. There was also discussion on whether or not accepting these funds would bring more potential positions into the county. And Ms. Cuddy assured us that it wouldn't. A lot of this may very well be contracted out to youth serving agencies, to schools, et cetera, or monies to fund current public health educators to do the same.
Get a motion for HH4?
Move it.
Second? I'll second. Any questions? All in favor?
Aye.
Hi. Thank you.
Government, me. Authorization to transfer funds in the county clerk's budget. We went through this at the meeting. That's GL1, and that's moving $10,000 from the salary line to the contract for the professional services line, so that this part-time support in the clerk's office can continue, given the fact that there are a number of vacancies in the county clerk's office. It got moved forward in government ops. I asked for a motion for GO1.
I'll move GO1.
Nightingale, second.
Any questions? All in favor?
Aye.
GO2, Kelly Albrecht came to the, Kelly Albrecht's here. She came to the government ops meeting, asking for a motion to approve the 25-26 budget for the Cayuga Community College. It was highlighted that the sponsorship from the county is the same as last year, with no additional increase requested. And you have other highlights?
Just, we're asking for a 3% tuition increase, so the fees have been increased this time. And everything else is pretty much exactly as it was. The only thing I do want to add is that we base this on an FTE, student FTE of 1760. We have already exceeded that for this year. So I feel as though this budget is very conservative and achievable. So, right.
Nightingale, move it.
I'll second. Any questions for Kelly? Yep, hi, Mark.
I heard you say the budget was the same as it was last year.
So the budget, for the county, for what our fund.
So we gave you 2.5% last year, is that?
Yep.
2.5% again?
Yep, 3.2 million, yes. Overall, our budget is higher, so that's a different percentage, but we're still asking for the 3.2, yes, for last year.
Thank you.
Sure.
All in favor? Do we get a motion in a second?
Aye.
Yep.
Thank you, I appreciate it.
Planning?
Thank you, Madam Chair. Planning has one resolution, been through committee, like to bundle PL one. Among the signing contract for United States Geological Survey for operation and maintenance of a satellite link flow gauging station on the Wasco Inlet.
I'll move the bundle.
Yeah.
Bundle of one, I'll second. Any questions about this? All in favor?
Aye.
Public Works?
I'm going to take my time so this lasts longer than the meeting.
Okay,
I'd like to bundle PW one and PW two. Both of them are to accept funds for Two Bridge, New York projects. I know the one over the Wasco outlet on North Division has been, we've been trying to get that one probably for at least 5-6 years. So this is well anticipated, and I'd love to see these move forward, and the work would probably happen next summer.
Okay.
Can I go any slower?
no. Can I get a bundle for PW one, or a motion for PW one and PW two?
Second, I can go.
Any questions? All in favor? Okay. Judicial?
Thank you, Madam Chair. Judicial and Public Safety has a total of 3 resolutions. I'll start with JP one, authorizing the chairperson of the Cayuga County Legislature to sign a 1-year contract with Gruber Power Services for maintenance of the uninterruptible, that's a mouthful, power supply in the backup 911 center.
Move it.
Second? Questions? All in favor?
Aye.
JP two, authorization to transfer funds in the Cayuga County probation budget. It's going to require 2/3, I believe, when it gets to the full edge.
I'll move that for discussion if there's any, and
Second.
any questions about that? Tyrone went through it.
Covered that, JPS.
Yep, and when he budgeted, he didn't budget the full 13,000 amount, but he only budgeted the 5, and now they're gonna spend the 13 and it's dedicated for that. So in order to spend it, he's got to have it put into that line.
And then it'll catch up with itself later, and then
Yep.
next year he's going to
Budget.
change the way he did it.
Yep. Okay, all in favor?
Aye.
And JP three, resolution to change the terms of the Sheriff's Employee Association of Cayuga County's contract to allow for qualified lateral transfer and consideration of previous experience of new hires from the county and state jail facilities to be hired with credit and consideration for prior service time when setting their starting salary.
I can go. Move it.
I'll second that. And does this expire? Did the sheriff say at the end of the year?
Yes, there's a sunset date on it.
Any questions? All in favor?
Aye.
Great.
Thank you.
Okay. So, yes, I don't know how we'll start, but, Sheriff, if you'd like to start because you're remote, then you can, whatever you want, else you need to do.
Sure, thank you. I did provide via email a written report. I'm not sure if all of you got that. I know Amanda does have that. It needs to be put up on the screen, but as I outlined in the report, we're trending pretty much at 50% with our budget, with the exception of overtime in the jail and our custody division. That number is up pretty significantly due to the vacancies that we have in the jail. We currently have 15 vacant positions. We have 4 people, I believe, right now who have retired, are no longer working. They've worked their last day, but they're still on the books being paid until they use up all of their accruals and time. And then a few members that are out, either injured due to fights and assaults in the jail or outside injuries using accrual time. So we've got some salary savings, but the overtime number is not really staying on pace with the salary savings just due to some of those other pressures, as well as the hospital details and some of the things that we've had, pretty significant hospital details recently, where we've had to detail members to be at hospital posts 24/7. So usually when we do that results in 2 members being on an overtime shift for each shift at a hospital. So there's been some strain. I noted in that written report where the overtime is in the jail to date, but that does not include the entire payroll in June, just due to the payroll dates. We had a couple of significant hospital details in June that are not fully reflected in that number. So that's the really the only area of concern I have at this point at the midpoint is that overtime number. But unfortunately, we have to man these posts when we don't have the staff, and that just continues to grow and grow and grow with our situation.
Madam Chair. Sheriff, I just wanted to note that I understand that the hospital detail funds will be reimbursed directly to your budget from the Public Health Department.
I understand that might be a possibility, but obviously, unless there's some type of reimbursement outside of the county, it comes out of our county budget. But yeah, some of that may come back from the health department to us, but I'm fingers crossed that we get some type of outside reimbursement for that one detail.
And Sheriff, I'm certainly not trying to pour salt on the wound by all means, but the significance of the 2025 year-to-date spending at 719,000. I mean, full transparency, that was only budgeted at 350,000.
Correct. And if you notice, I did in the report include what we've trended at each year, which you can see over the last 3 years total where we're at the midway point.
Yep.
This year that was budgeted at 350,000. Last year it was budgeted at 400, but we were certainly over halfway through the year last year too. This is a continuing trend just due to vacant positions. But we've had additional strain this year with the number of people retired that are still on the books and the additional hospital details. So I think the salary savings, which I don't believe I have, we didn't calculate that for last year or 2023, but the salary savings was keeping up more, was more in pace with what we were spending. It was a little bit closer than what it is this year. We're just seeing some separation because of those other pressures, but the additional overtime is nothing new over the last few years due to all the vacancies we've had.
And when we met, just preliminarily, I give you, you did say clearly that this is not the first year this has happened. Because if the county or the legislature wants you to do something different when you exceed that budget line, all they have to do is tell you, bring a resolution forward, do whatever. But at this point in time, last year, your part-time line pressure also was significant. So this isn't anything new. Is that correct to say?
Correct. That's why I provided and that's why I provided the 2023 through 2025 performance at the mid-year point for each year, just so you could kind of see the trend.
Yep.
It's a continuing trend. This year, there's just a little more pressure.
Yep. Okay. And you have 15 vacancies of your custody, but you're hoping to fill how many of those?
Well, I'd like to fill all of them at some point, but unfortunately, we just can't seem to get there. We do have some people that are going through the background process. We have a few that are in the hopper. If, it looks like we may have 4 that are going through the process now that may make it through, but we're not there yet. But just to give you some perspective, since mid-March, when we started doing our open houses and open recruiting night or days every day on Thursday, we've had 171 people apply. We've given out 100 background packets with 50 of them returned. And we're down to less than 8 people that we're actually looking at that we could potentially move forward in the process. And we're certainly not going to see all of them make it. So it's just a tremendous amount of work, a tremendous amount of people that are applying. But, to get qualified people, we have to sift through a large number of people. And unfortunately, there's just not a lot of real quality candidates that are applying for the position.
Yeah. And the only other area that your federal inmate revenue is somewhat down, but your board-in revenue is higher than budget?
Yeah, so yes, as you said, the federal revenue is down significantly to where we would want to be, but we did make that up with our local board in revenue, which are from other sheriff's offices in the region that have needed some space. So we've been able to make that up. So our revenue number to date is in pretty good shape between the two budgets. We're also going to receive some reimbursement from the state for the state ready inmates that we've been holding beyond 10 days that they haven't been taking. We
Okay,
did take a few recently, but we've had a number that have been with us beyond the 10 days. So at some point down the road, it's not reflected in these graphs, but we will have some additional revenue that will be owed for the first half of the year for those state ready individuals as well.
great. And how many do you have left still, Sheriff?
So state readies, actually, in recent weeks, we've had 16 taken. We're down to 8. But we're starting to see our parolee numbers climb. We have 13 parolees who've been rearrested on new charges. We have 6 who violated parole. So that's 19 individuals that are on state parole now that we have that we're saddled with holding and taking care of all of their expenses, including medical. So now we're seeing that number start to rise. So, you know.
And there's no revenue from the state parole?
No. I believe at one time, many years ago, they used to reimburse counties for some of those costs, but they shifted that back to local municipalities, and now we're saddled with it. But as the state releases these individuals early, this is what we're going to start to see. We're going to start to see these numbers, increase to a certain degree, and we're already seeing that. And I've talked with a number of sheriffs. I was with a group of them today and brought this subject up, and they're seeing this statewide. They're seeing their parolee numbers start to increase, those that have violated parole and those that have been rearrested. So if we push them out of jail early, we're going to see these numbers rise, and it's going to become our problem at the local level instead of the state's.
Any questions for the sheriff?
And if I could just add, Elaine, I'm going to be talking to Senator May about this. I'm meeting with her next week, but I think it's really important that all of our municipalities across the state start putting pressure on their local elected state officials to look at these things, because we're shifting costs from the state to the local municipalities and we're picking up this burden. But I'm going to talk to her and our local electeds about these costs that we're saddled with, and we're letting people out early, or when we're not taking state ready individuals when they should be taking them, and we're saddled with the medical costs. So I think that the legislature ought to be looking at that and speaking to them as well.
Good point.
That's a good question.
Yep. Oh, Heidi, then Amy.
In order to make, and I'm very willing to make those and will make those calls to our state, local officials. In order to do that with the 16 you mentioned of local parolees that violated, can you provide me with how many of them were the early release folks?
I don't have that data for you today, but I can certainly look into that. That is something that I would like to know as well. Like,
Yeah, I
who's
really
been
want
rearrested or
accuracy
who's
on the issue.
I agree. It's something that we do want to know before we have those conversations or make those calls. But seeing these numbers creep up and seeing that that's happening across the state, I think it's a pretty safe bet to say that we're going to find that some of these individuals were released early and have reoffended. But I will look at that data and I will get back to you on that.
Okay, thank you. I'm very willing to follow up, but not with sweeping generalizations, real data.
Understood. Agreed.
Amy?
Yeah, I just had a question. In the coming years, if there are changes to Medicaid and you have more inmates that are uninsured, does the cost of their medical care fall solely on the jail, or do you have additional revenue to safety net? Like, will that cost add to your budget if you have inmates that?
I'm not sure they're Medicaid eligible in jail.
So they don't.
They lose their Medicaid while they go to jail, Sheriff?
They are not eligible for Medicaid while they're
Right.
incarcerated. The county has to pick up medical costs. The only area that we don't pay for the medical care would be like our federal board-ins or our board-ins from other county jails. We don't pay for any of their medical costs. And if they need additional medical treatment or something that would require us to watch them at a hospital or transport them, we would either call the feds, call the marshals, or call the local sheriff to come pick them up. We would not cover those costs, but anyone else, we're saddled with those costs, including the parolees that violate. The state doesn't reimburse us for that. We have to pay for their medical coverage and care, and nobody in jail is eligible for Medicaid.
You might help them apply for Medicaid upon release so that they're, they have insurance and all that, but during their incarceration, even if they were eligible prior to coming in, they lose Medicaid eligibility, right?
Correct. There is one area, if an individual from our jail is actually admitted into a hospital beyond a day, if they're not just in and out, if they're admitted, they stay overnight. At that point, that can be billed to Medicaid because they're actually admitted into the hospital. But when they're in our custody and care, otherwise we have to pay for that.
Thank you. Thanks, Amy.
So if they need medical assistance, then the best thing for them to do is to violate the parole. That way we have to take care of them.
Well, if they like jail better than health insurance, I don't know, maybe, yeah. Any other questions for the sheriff? Thank you.
Thank you.
Okay, anyone who wants to go next? Who's on the list? Who wants to go next? Okay.
So the one pager is a little bit of a summary, like I did the last time around, our analysis of the areas that we were asked to look at. I'll go over those areas, and then the second packet you got is our actual year-to-date budget report, and we can go through that, and we can talk about some of the highlights that stick out and answer any questions you have of things that you see in there as well. So our analysis as of the end of June for salaries is that we're under budget, coming in at about 39%, which is really due to the vacancies that we have. Right now, we have 118 employees on our June payroll. We have 137 positions, employees budgeted. So that's really accounting for us coming in at 39% versus the 50%. We have vacancies right now with caseworkers, human services examiners, social services investigators, junior accountant, and social services attorney.
Not all related to the hiring restriction, but some.
Correct.
Yes, some, and them are irregular vacancies.
Yep. And then ties in with our overtime coming in higher than we would have anticipated at this point through the year. We're attributing that to the workers that we do have working additional hours to complete the work in the mandated program areas, services, children and family services, adult protective services, and in temporary assistance program areas as well. If you want to see the numbers for those, they are on page bottom area of the payroll, salaries, overtime, and salaries. So for equipment, last time I talked about this, we were up on our equipment trackables and our office furniture. That's actually on page 2 of the packet in the middle. Where you can see that we're coming in at spending almost all of our money in both of those areas. And that's really related to the purchases that we've had to make for this to get up 63 Genesee Street up and running. All of the IT equipment, the cable and wiring for 63 Genesee Street, computer equipment, that was the equipment trackable, and then office furniture is everything, the partitions, the desks, the file cabinets, everything we needed to get ourselves up and running. Even actually prior to 63 Genesee Street, but mostly 63 Genesee Street.
But even with that 89%, you really aren't anticipating
No,
any
we're
large
there. We
equipment
spent,
costs
I think
at
we
this
spent
point.
what we need. There's still some expenditures that we'll have, but nothing that's going to be huge, like we've had to spend.
Do you have extra copies? Amy, Sergeant Miley. Did you get one to?
Tomorrow.
I gave one to.
Okay.
Thank you.
Our contractual lines are really on target, that just haven't been, out of line. Contracting for the amount that we contract for, have a resolution to contract for that amount, so it's really lining up where it should. The large volume revenue accounts, I think I talked about this before, that, the way that the reimbursements work for DSS is complicated, and when we receive reimbursements and allocations from the federal and state government, it just varies. Like when they come in, it's not like we're at the end of June and everything for the first 6 months is here to capture. So actually in this year-to-date report, we only have the reimbursements through the end of May. So 5 months versus 6 months. So that's going to throw some things off. And I can even talk about it like maybe next month at HHS to let you know if it just significantly changed anything, but expenditures are in for 6 months. The reimbursements are in for 5. And then it's really, there's important areas to consider that I can reinforce some of the stuff that we talk about all the time around the high cost areas in DSS, including safety net expenditures for single adults. That is our lowest reimbursed program area at 29%. And it really is tied into the high cost of housing single individuals in hotels. As a side note, as of the 11th of this month, we were providing emergency housing to 91 individuals and 21 families. I had been giving, excuse me, some good news about our numbers over the past couple of months, and we've gone up a little bit from there. So we were down at like 85, and now we're back up to 91 individuals. Our families, interestingly, have gone down a little bit. So there's this kind of swing and variance that happens. But definitely safety net is an area of pressure on our budget.
Do you, Lynn or Grace, do you recall last year, the safety net spending was over budget? Does it look like it's tracking to be over again?
Yes.
As significant as it was, or how much has it been 70% of your budget's already been spent? I'm just
67%, I believe, is what we have for safety net that's been spent right now. But again, we don't have some of the revenue has come in yet. So it's hard to look at it today and say, this is exactly where we are and where we're going to be.
As we get a little bit farther, we're going to pay it no matter what, but you're going to give an idea of whether or not we're going to be close to budget numbers or under. Our budget will be under again.
Right.
Expenses will be higher.
Yep. I don't know if you remember how we are close to 67%. It means it's hard to know where we were. As opposed to last year, you mean? Yeah, I can keep talking. All right, go ahead. So the other area that I wanted to just highlight again as can be very, very costly area of our budget, and we have potential to go way over, is on foster care costs. The cost for foster care children that are placed in the custody of Department of Social Services, removed by court order by family court, placed in the setting that most meets their needs. Some of those children are placed in very expensive programs that are residential based. Right now, we have 14 children out of 106 that are placed in residential. So we're at over 10% that are placed in residential. That's a higher number than we've had recently and over the last year or so. And we've had some kids that have come into foster care that have significant behavioral needs and mental health needs, concerning behaviors, and trying to find a setting for them that's going to be able to meet their needs has, been challenging, and they're all costly, up to $1,000 a day. So a couple of children coming into foster care can really swing the budget when you have the child remaining in foster care for the whole year.
And you're still reimbursed at a block grant level, but anything over that block grant is wall 100% local costs?
Eligibility.
Maybe with
Yeah, I don't,
federal,
yeah.
yeah, some federal funds, but once you exceed the block grant,
Is open-ended.
okay, so if you qualify for 4E federal funding, there'll be some reimbursement.
Right, and most of the children are not 4E eligible. It's just, that's, I don't know, like what it was like when you were a commissioner, but like our 4E, qualifying rate for the kids that come in is not like anything like super high. It's around 30%. So, you know, and the reason for that, I think, is the federal government has very much like tightened up the regulations around 4E. There's a lot of auditing. There's new tools that we can use to make sure that we're only coding folks that are 4E than as 4E. I think that there were a lot higher error rates in the past. We were capturing 4E when we shouldn't have been. So 30% is really not off the mark for like where most counties are. It used to be a lot higher.
Is the block grant like millions of dollars? 2, 3, 4,
Four.
4 million?
Yeah.
I don't know, but it's millions.
I didn't remember.
So I think those are really the areas that, as we look through this, if you look through these pages, a lot of the areas that are up that you'll see are really tied into foster care costs and the safety net
Housing.
program area. Some of them that I kind of highlighted that just jumped out were the really bigger numbers.
You want to know what the safety net will?
Sure.
Like, we're projecting 5,000,008 spending, and they only have 5,000,001 budgeted.
In safety net?
Yeah.
Oh,
It's
so
higher than last year.
And that's our numbers have been going up. Our caseload numbers have been going up. The number of cases who have emergency housing needs have continued to climb. I mean, this is, you know, things I've been saying for the last couple of years. I know. What's that? Perfect. Do you have any questions about any of that? Elaine?
Oh, Mark?
Hi, help me. Help me understand here a little bit. And I want to talk about safety. Then you said we're gonna get 5.1 million in the grant.
No, we have budgeted 5.1 million on the safety net, and it looks like it's gonna be 5.8 million in spending.
Okay, so,
That's just the spending, not the revenue.
okay, so we're spending 5.8 million. It says DSS only received 29%, so we're responsible for 71% of that 5.1 or 5.8 million. We're responsible for 71% of that. And there's nothing coming federal or for the state or anybody
That's what we got. That's why.
we're mandated to do this, but the mandate only covers 29.
Correct. Yep. Correct. That's why it's a really high spend area for us with low reimbursement.
I just want to note too, future thinking and budgeting with the beautiful bill. There's going to be the work requirement, and that's going to need to be completely funded by the county. There's no, it's just it's just, again, an unfunded mandate to get people to work, to supervise them, to, you know, prove and document that they're working as required, really with no additional funds.
They have work requirements now. Safety net does, right?
So the waivers are going away for the counties that almost all the counties have waivers. So the ABOD population is going to be going back to work requirements that are going to have
ABOD is able-bodied.
bodied adults without dependents.
Okay.
Um,
They don't have them now, work requirements?
There's a waiver.
There's a waiver.
There's a waiver that they don't have to do those, and it's been in effect for years. And all of the counties except for one have that waiver, and all, those waivers are pretty much going away for most folks. There's certain populations that will be able to still not have to do the work requirements if they have a disability. But a large chunk of people will have to do the work requirements, which is going to, you're right, put a strain on the staff, to track that, give information about, where to go to fulfill those work requirements, and do reporting. Really, there's going to be a lot of federal reporting that has to do with that.
Christine, would that bill though not affect safety net? Because safety net's a state program. And that's not part of the federal.
True, that's
Right,
right.
so safety net is not impacted by any of
Yeah.
that.
So that's
That's a New York State program.
For SNAP.
Okay, so the work requirements that are on Medicaid, there'll be work requirements on Medicaid as well at some point? And food stamps, there already is?
Definitely for SNAP.
SNAP.
For Medicaid, I'm not sure about that. I haven't received as much information yet about the Medicaid and when things roll out for Medicaid. But there is a huge change for SNAP.
I think what what Christine had said at one of the meetings is that in October, Food Stamp Administration, the state doesn't, SNAP, the state doesn't give any money towards administering the program. The federal government gives 50% for the administrative costs, the stamp costs of the program. October of 23, they're going to reduce their contribution to 25%. Out of the gate, the county will have an additional $500,000.
They're estimating
23, you mean 26?
October of 26.
October of 2026, we'll start to have
Yes, yeah.
increased expense for administration of the SNAP program. They're estimating that our contribution will rise by $554,000 per 12-month period per year. So it doesn't start until the end of 2026 for us.
That's how we streamline things. Push from somebody else.
Yeah.
It's a huge cost shift. Counties.
Yep. Yeah. General question, if I may. We get reimbursed on a lot of different levels and it sounds like it's very complicated. Is it possible to reconcile all this and know that we're getting all the money back that we have coming? Or is it somewhat of a shell game at some point and we're keeping our fingers crossed?
Well, I can explain that. I mean, it's, the block grant that Elaine was referring to is very unusual. Most of the funding is not dollar amounts, it's percentages.
Right.
So it's important, that's why it's so critical the job that Tracy does is the categories that we put the expenditures on the claim drives what we get reimbursed. So that's where we've just said that's the complicated part. So, but there was no tying back to say, oh, it was a grant, they should have given us 300,000. Did we get 300,000? It's usually formula driven, 29% reimbursement, 50% reimbursement, maybe a lot less. And then, oh, we're just gonna take money away from you on this bottom line charge because we paid this on your behalf in Albany. And so now we have to charge you for the fingerprinting that we provide free. So there really is no tying anything back. We keep accounts receivables, a big, huge spreadsheet that we track and sometimes they give us advances ahead of time. That's the other thing that they do is they will advance money for benefits. And then we put the claim in and they pay the difference. So we do keep track of all that and, follow up on anything that hasn't been paid in several years, sometimes they'll go, oh, yes, we haven't paid that. Yeah. It was like 4 years old. So it still just sits there. So we do monitor that. That's a big reconciliation that they do all the time to keep track of that. But most of the things that like the foster care block grant, actually they give us our 12 payments in a year and we usually compare that back to this LCM, which was a letter that told us how much money we were getting. So we do definitely, that's like an internal thing to track.
So if you're reconciling that, so to speak, would it be possible for someone to give us a number at a certain date what do we reconcile our numbers? What do we expect should be coming to us that has not?
Well, we
It's
have
not
a
like-
receivable balance every day. It's on the
Yeah.
balance sheet right now that it's recorded, that they owe us, let's say, $3 million probably. Oh, yeah, but that's.
Every claim.
But what I'm saying is that $3 million that's out there,
Right.
we're not sure that we're gonna get the whole 300,000 or whatever.
Well, we should be,
We
yes.
We should be, but we aren't guaranteed it.
Well, typically when we do the claim, that money that she's recording in the receivable is revenue that we are gonna get,
Right.
we're gonna get.
I understand that.
And we book that.
It is what we're gonna get.
That's what we're gonna get.
Except when they tell you, oh, we already paid you this, so we're not gonna give you that.
Yeah, but there's not.
Not really, no.
There's not really very much of that.
Like they'll do like when we go over, like in this Title 20, there's very little money. As soon as we go over, they'll start doing this thing called a ceiling adjustment and they'll tell us, oh, we're not paying that. And we know that. I mean, we track that also. So there really are not a lot of outstanding receivables.
So do we-
that get paid.
So do we have an idea of the outstanding receivables, like 90 days, 60 days and 30 days, almost like you'd get on a statement?
We could, and
Billing?
we have it more by month and year. We don't summarize them in that way, like you're saying.
I just think it would be interesting information for legislators if we could get, and I don't want you to do it on a regular basis, just
I mean.
a snapshot at the end of June or the end of July or something, just a snapshot.
Like what's owed us?
Yeah, just,
So what the receivable, the 400, the big 400 receivable that Tracy's doing is, it does break it down by quarter and by year. So like we could even tell, first quarter of 2023, they still owe us this much, so she could probably just print out basically that cover page. And it would show you what's outstanding for each quarter for the last.
so if we could get that within a week or so, just a snapshot. I don't want to real complicate or anything. Just so we as legislators just have a general idea. I would appreciate it. Thanks.
I think what's tough with the DSS budget is there's all these moving parts all the time with the caseload shift, the, kids that come into care, kids that are, that leave foster care, go back home, kids that are adopted. I mean, we never know sort of what's coming in the next 6 months around those types of cases.
Barely know what happened yesterday.
Yeah, so it's hard to really forecast. So to see these numbers now, we might have a good month, we might have a
Totally.
I mean, that's it's in when we come up with budget numbers, when we do the budget process, I mean, a lot of it honestly is a guess and we try to guess low.
Yep.
Because we're hopeful,
Right.
we're hopeful that, things we'll have a good year and maybe some of the stuff won't happen and we won't have to put so many.
It's the same as budgeting for high need kids in school district.
Yep. So.
Never know.
Right.
So it doesn't surprise me that we're up. But we'll go back at it again and have hope again for next year. And I think, paying attention to, our eligibility determinations for kids in foster care. I mean, there's things that we can do to make sure that we're capturing as much reimbursement as possible. Because they are high cost programs and high cost,
And also trying to limit our exposure
correct.
to liability.
That's right.
Mhm.
Yep, exactly.
Because that could cost us even more.
Yeah, exactly.
I
It's a balance.
totally get it.
So I don't know if you want to look through this and you want to, have me answer questions about things, or if you want to take it and if things jump out at you and you want to email us and we can talk about it more that way, whatever works for you. I don't want to take up.
And were you wondering about like just a snapshot of what's outstanding and owed to us based on, do we have cash flow? I mean, it would give you a full picture of where we're at and what think we're due to come in.
Yeah, but I mean, it's like I said, it doesn't have to be real complicated. It just, because it changes all the time.
Yep.
So just.
We also have to understand that, might be a real high number you give us and then the day later we get a $500,000 check. Who knows?
Just to clarify on that though, Ben, the receivable, so that money is already recorded.
Mhm.
So the revenue, it won't change, but it will change your cash flow. That's,
Right.
okay,
It's nice to see it in here, but it doesn't mean that we have it in hand.
right.
Right, Dave? You don't have the money. Write the check anyhow.
Yeah, no, if I could, just Set back to the salaries portion. Says we have 118 employees. We are budgeted for 137. At least 29 positions is budgeted. There's a way to ask that. Is there a way we can know if any of those positions are been open for more than a year and those that are open for less? That
We can get that, we can easily get that.
I'm sure that number probably changes.
Some of them are just sort of this revolving door.
Right, the caseworkers.
It's the
like
caseworkers.
Yeah, that's like,
Right.
that probably changes on.
Social
Right.
services attorney's been on the list for a long time and we've had a couple of hires that have then left in a relatively short period of time. So we've been struggling to keep someone in that position and
The rest of them have not been
have
open
not
for
been,
more than a year.
yeah.
I guess where I want to go is, if we've got a position that's, and I'm just hypothetical. If somebody, that position has been open for 2 years, can't seem to fill it. Could we not budget it and then, let's just say, the day after we do this, somebody sends you an application with the, God saving grace to the position, and we want to hire them. Would we not just simply go and have you guys come to the legislature and say, look, we need to hire this person, they're exactly what we're, it's taken us 2 years to find them. Can we fund that position? Is that possible? Legally, can we do that? I mean, I'm just trying to look at where we can save some.
I mean, I think you
money.
certainly could do that, but in our budget, we also don't budget all of our positions at 100%, knowing that we are gonna have vacancies. So we already have salary savings that we're not having our budget be more than it should be, or even what it should be. Does that make sense?
You're referring to the salary adjustment?
Yes.
And does, so
Yes,
if you have the cost of 137 people, she'll do an adjustment and say, well, we'll reduce this by this much money, because we know we're gonna have vacancies. So that we don't don't tax people.
Correct.
Ours is $450,000.
Your salary adjustment line is 450?
425.
Oh, sorry,
425,000.
Oh, I'm a little confused because it says, and that's not hard to. It says 137 positions budgeted, so you're not funding.
Nope.
By 50, you're not funding the whole position, you're only funding half of it, is that the way I'm?
No, what, do the salary,
I'm just asking,
Right?
make it simple.
right?
I mean, what we do is we budget everyone's position, we budget all their fringe benefits, health insurance, retirement for everybody. And we come out with, let's say it's $10 million. So instead of taxing people on that whole amount, when I know there will be a bunch of vacancies, we actually budget a negative number. That's what it is, negative 425,000, which kind of would go against everything. Someone's salary, someone's health insurance, someone's dental. And it's just a way to kind of be like, we don't want to be over budgeting, but we just know in the big department, you're gonna have turnover. So we've been doing this for quite a few years. It was lower before, it was 350,000, then 375, and this year it's 425,
Right.
They're running a lot of vacancies in that department. So we are kind of doing it already on a gross level and so when it's accounted for, how many we got, our 22 caseworkers, 4 supervisors, so we budget everyone. And we'll do that.
And I don't want this to be at all. I really want this done for every project. You've got, you're budgeted more than what you actually have. I'd like to see a breakdown of every department in this county that says, I've had this position open for more than a year. I'd like to know, but I think the legislators deserve to know that. And then if, I don't understand what you were talking about then, what's off my head, but.
I mean, people probably go through that during the budget process. And HR will then they will say, because, we're gonna budget people who work here, like they're employees, and then if there's vacancies, then we get that information for those positions.
I'd like to see that given to the
Yeah.
legislature.
I mean, that's the way to do it
Every
probably at that time, like they give you the information.
We can get you our list. We don't have anybody that's been,
I don't want to make it sound like I'm looking at it.
but I don't.
She does the same salary issue with the custody
Right, but it's really not working out now. The overtime is.
Right.
They are with no savings.
Our overtime isn't as high, like the sheriff was talking about. We don't go that high on overtime.
So you do have.
We're still within our budget.
Overtime, but yours is not crazy, right?
Right.
Just a little bit of overtime here and there.
I just wanted to note
Inclusive
that,
of the 700,000 deficit you're projecting. So if you had budgeted at 100% staff, you'd actually be another additional 400,000 behind, right? Because you did.
For the sheriff, you mean?
No, for the.
DSS.
Yes, for the one that you said that was your budget at 5.1 and you're gonna spend 5.8.
That's safety net.
Yes,
That's sorry.
So what does the staffing budget come out of?
A different account.
And how much did you project the turnover rate? Like, is it coming out what you thought?
I haven't. I mean, it's a very global, high level number.
But like, if you look at this,
I don't like do a percentage. I
Right.
haven't figured out a number of people. I just don't do it that way at all.
but if you look at this though, right now, total, we're still at 43.2% after 6 months. So we're below. And that includes your salaries, your fringe, all of that, and taking that negative for Twitter.
Right.
Yes, so we've met that.
I'm still at 50.
Yes.
I kind of see where Mark is going, but if I remember when we did the budget last year, we already looked at a lot of the vacancies that were been open for period of time. We cut them out of the budget already.
we did, I think we cut 6 out of social service,
Yeah, so I mean,
cut them.
I think that's kind of the direction that some people are looking at. And sure, we can keep doing that. But I also want to remind people that we already did some of that already this last budget season.
And Christine had handed out some information when we met that showed in DSS, because they're a big budget, they had 147.2 positions in 20, 145 in 21. They're 144 and a half in 22. They stayed at 142.5, 142 employees, and then between 24 and 25, to your point, Ben, they went down to 137.2. So there has been a reduction in staff over the course of the last 5 or 6 years.
10.
Of 10.
So how many other departments have done that? Thanks, Brian.
All right,
I didn't have anything else prepared to say. I was happy to answer any questions, or like I said, if you want to get in touch with us, if you look this over and
appreciate.
things jump out at you. Thank you.
This is.
Brian's always supposed to go last.
Yeah, oh, sorry.
It's all right. I'll go in the middle.
That's all right.
Mr. Strong,
Oh, shoot. How about you? Easy, trust me. Could have been two.
Brian, can I have it for the minutes? I know.
Brad, do you want one?
sorry.
You've got an extra.
I got one left.
Something with that tree.
Thank you.
Not much different than my last report. The only thing that I have any concerns about is our utility accounts. The power and telephones to be on gas. Those are the only things I have that are running over. Our projects are all running good. They haven't been completed, and the ones that are starting are still, everything looks good. Good.
Can I ask you a crazy question?
Look at the budget.
Have, oh, maybe it's the highway defund or if your salaries on the first page, if you've been down a number of those MEOs,
Yep,
how do you have 50% of your budget spent?
can't explain it other than it was a hard winter.
Oh, okay. So even though you have a number of MEO vacancies that you have kept it vacant because it hasn't been plow season,
Yep.
there's no additional line for full-time salaries. That includes overtime in that?
I do believe, yeah, she put everything in one.
Okay, so, because I was thinking, how could that be? But that includes,
She lumped it all to one on this report to simplify it a little bit.
okay, so overall, you're still around half of the money spent.
Yes.
But that includes both, and that's why it doesn't look like it's less, because the overtime.
Yeah, the overtime in January, February, and March were excessive this year.
Madam Chair.
Sure.
So, Brian, you're talking about 54075, the telephone
Yes,
at 186%.
correct.
Is that something that
Ring
we can
Central.
talk to Amanda about, or
Ring Central.
it's Ring Central?
They changed us to Ring Central without telling us, and we couldn't budget for it because we didn't know what it was gonna cost us.
Well, I think what actually happened,
Okay.
there's some truth to that. I think when we bought the Ring Central last year, it got paid out of the IT budget because we were switching from 8x8 to Ring Central. And a lot of the departments are gonna have that same problem, and we might have to do a resolution later because this year, we're spreading it out to the departments because we always want, especially social services, health department, mental health, pay their own ways they can claim for some reimbursement, and then we always charge the highway fund also for what they use.
For what they actually.
Ring Central is,
No.
It's yes, it's based more on like their number of phone lines.
We upgraded from 8x8 to Ring Central, which sucks compared to 8x8. And now it costs us twice as much.
which means you can answer your phone on your computer? Is that what Ring Central is?
Answer your phone on your phone.
You could on 8x8 as well,
Yeah.
yes. That would be a Tom Bun
I'm
question.
sure
It
the
wasn't
IT
us.
director could put a little more information to that than any of us users can.
So that wasn't an expense you knew you were going to have to incur
Correct.
before the budget passed.
Correct.
And,
Tell us what you really think.
right,
I'm holding back if you want to know what.
my God.
But can I say, my observation is that most of the department heads by expression are agreeing. So something to look at. Just an observation.
It's an issue.
Highway DM fund salaries overtime at 338%.
That is an anomaly because what that is the way we charge back for the snow accounts. Our plow operators come out of D, the mechanics when they're plowing, it's all overtime, of course. And
Everyone is budgeted in one account, but like he's saying, during the year, they charge out actual salaries to where they're
So,
working.
that's not
It's hard to
actual.
do the budget that way because you don't know where people will be working, so you kind of have to look at it globally when you look at them all together.
In a perfect world, the mechanic should never be plowing.
In a perfect world, what?
The mechanics should never be in snow plows
But they sometimes they are, because you need.
when
them
we're
to.
short.
Yes, because you need them to.
Yep.
That's why we want diesel mechanics, not auto mechanics.
They're required to have a license, correct?
But as far as you're concerned, Brian, there's nothing,
There's nothing to get excited about my budget. We seem to have a little more control over ours than some of the other departments.
Yep.
If we're running over on a project, we don't do as many projects.
Mhm.
I just push stuff back, so. But everything's running good. We've completed most of our work and I think we're gonna make the season.
and we approach the fall and snow season, you're looking at how many vacancies of MEOs do you have right now?
We have 5 MEOs, 1 heavy MEO, 5 mediums, 1 heavy. My stores clerk is retiring, so he'll be open. And I have a mechanics position still open.
That you have permission to fill, you just haven't been able to fill it.
Yep.
Yeah.
I'm gonna put all those resolutions in next month, so you'll get a real accurate count of them all.
Well, if you already have permission to fill, you don't have to,
All the other ones.
the
Yeah.
MEO kinds.
Yes. Yep. I'm gonna put them to the August cycle.
Unless they're already in an extended resolution with it already in there, so, right, yes. Okay, we can talk about that.
Yep.
Okay,
And it looks like obviously those those absences or vacancies would naturally lead to the 338% in overtime. Because
I don't think,
you don't have,
I don't, that's.
what
No,
leads
that's
to
from, that was from this winter, not having enough people to plow. Our
Okay.
mechanics had to plow, and it's all on overtime.
So your plowers, what is that title, the person who, when I'm looking for it?
Everybody at this point, including myself.
If you're short, MEOs are the ones.
By job description, it's not the MEOs?
So,
Okay, that's what I'm asking for.
Medium MEOs.
Yeah.
Heavy MEOs and the diesel mechanics. All the supervisors, myself.
And it's because they're qualified and it's because it's in the
carry a
job
C-
description.
carry a CDL.
We can do that via civil service.
Correct.
And you're down this many, medium and heavy and a mechanic and.
If we don't fill those positions before winter, we have a huge problem.
Heidi,
And it's not that they're holding me up from filling them either. It's.
Right.
We have no applications.
Right.
and you purposely left some open
Yes.
in anticipation of getting to plowing season because you felt you could do without until that
Right.
critical time.
Yes.
Correct.
Guardrail and the bridge account, looks like you haven't spent any money there. Do we expect? Is there bridge, work to be done this year or not?
Not on the capital side.
Uh-huh. The numbers that we see here are kind of like for emergency type of, like if there's an accident or something?
The capital side, yes.
Let you two know what you're talking about. What was the, I don't know what you asked.
Under road maintenance expense,
Okay.
he hasn't spent any of the money in the guardrail or the bridge expenses.
Guardrail seasonal, we do that work in the fall. And our bridge, find it here.
Once for 300,000.
Yes, well. The 300,000 is what we would use for Bridge New York to offset our 5%. But the projects won't start till next year, so.
Right, so we don't expect any of that money to be spent this year.
No. Unless something falls apart tomorrow.
And it would have been eligible for reimbursement if you spent it?
No, that's our 5% match.
Okay, this is the 5% match?
Correct.
So if it's in there and you don't spend it, it just goes unspent and rolls back in.
Yep, fund balance, yep.
But if you committed to a project this year, we might still move it,
Mhm.
Right.
Right.
even if we don't spend it, we'll put it to the capital page.
True.
So that's that way.
Once we form the capital H, yes.
Yeah, we'll transfer it to capital H, so he might do that.
And that's not the reserve. That's different.
Capital H is project specific.
Right, okay, so it would go in there waiting for the project to be done
Correct.
Right.
instead of swapping it back in.
Right, it funds it.
Otherwise, we gotta put it in next.
Right. Okay, and you have a number of capital H's in the highway department?
How many do we have currently?
Not that many, I'm just laughing, I just said
Oh,
that. I think
pretty-
you wrote
pretty
some
close.
resolutions though.
Yes, there's
Yeah,
two
it's
resolutions
some
to create
resolutions
them,
coming,
but
that's,
To create capital H's for certain projects.
I believe we're closed out of.
yes. a bunch
Everything
of
else
them
is closed
finished,
out.
yes,
Yeah, we
a bunch
closed
of them
out pretty
finished.
much everything else.
Yeah.
I think Jericho was the last one.
And it's done.
Yes.
Any more questions for Brian? Okay,
Thank you.
oh, Lauren.
Thank you.
Thank you.
Thank you. Yep.
Okay. So just a couple things, as far as our salaries, we've had a number of vacant social work positions specifically. And we have some cost savings that I think I talked about previously, I presented as well. We currently and this is the budget as of, the end of June, just so you guys know. So that's about $133,000 of savings in salaries. We have but an important thing to note is, obviously all of those social work positions are revenue generating positions. So you'll see we have savings in the salary line, but also, as far as our clinic revenue too, I think that is. It impacts that too. And I know Lynn can probably explain a little bit better, but there are other things kind of budgeted in that line, like that Carol was kind of talking about when it comes to, some of the revenue we're getting from some of the grants that we have as well. So that's not just reflected of clinic revenue coming in as well. And I think that the salaries line was also increased for that as well. So it kind of offsets each other, but just important to know that there's other things in that line, not just the clinic revenue coming in. And we've also had a part-time position at the jail that hasn't been filled for this whole year. A social worker that's at the jail.
This is a mental health position that you provide to the sheriff's department that has not been filled.
Correct.
But it's in your budget.
It is in our budget.
Yep.
So, and I'll talk about that a little bit too. So for the last, we provide all of the mental health treatment in the jail, through our budget. So, that includes 1.5 social workers. And, we also have 3 nurse practitioners that receive a stipend to do the jail work on top of their work at the clinic. They're on call for, a week at a time where they provide, around the clock care. If there's anything needed, they're on call for that. So that equals out to be about $200,000, that we don't get revenue for it. To Amy's question before about Medicaid, we're not able to bill or get any reimbursement for any of the services that we provide in the jail because they aren't eligible for Medicaid while they're incarcerated. With that being said, I know we've had conversations too around looking at some other revenue sources, specifically around opioid settlement funds, to be able to use some of that to offset the cost of our social workers at the jail. So that is the plan, that we're going to move forward and bring some of that into our own budget to pay for some of those positions, because we aren't able to get any revenue.
Say that again?
Opioid settlement funds, we're going to use those.
You're going to try to replace some of the county related costs of the jail.
Right.
With those monies.
We won't be able to use it for the nurse practitioner's time, but I think we can. I think it qualifies as an approved use when it comes to the social work that we're doing out there, but not the nurse practitioner. So, what else? As far as the 730 line, which is, it's at the very, very back page at the end. Not sure who named the budget line, but it's Family Court Eval Article 251/Psych Criminal is the name of the line. We budgeted, I think it was 110. So we have had, just so everybody knows, we have had 2 people. They didn't go on a 730, they went on 508s, which are when someone is unable to be cared for at the jail because their mental health symptoms are too great for them to care for them. So we had 2 people go to the hospital. One went for 5 weeks and one went for about 2 months. We have not received the bill for that yet. So that's why, you'll see that none of that has been spent. But my estimate of what that would cost would be over this budget, which would be about $126,000 or so. We haven't had the bill yet, so I can tell you more accurately when I would have to come and do a budget adjustment for that. We do not have anybody pending. There was going to be someone else who was going to go tomorrow, but we reevaluated her and she was competent, so she will not be going.
The judge was concurred.
Yes, as of this morning, everyone concurred to accept the new evaluations, so she will not need to go. There's only one other person pending who needs a third evaluation or examination. So that's happening this week, I believe, this week or next week. So once that happens, we'll know if she's competent or not. So That's the only other one that's sort of pending at this time.
That's good news.
Very good news.
Yes, it was lower than
Yeah.
last year,
Yeah.
which shows it's just such a,
Yeah,
Yes.
yeah, you just don't know. You don't know. And we looked at in our budget discussion, we looked at the last few years and it's really, it
It's up
was,
and down.
there was one
There's
year
no-
there was zero, you
no
know, so,
pattern.
so I'm hopeful where we're at this point. We did receive, so in this, what's reflected in this budget, I'm not sure if Carol put we're getting additional state aid for, our mobile crisis program. So we had, used some grant funding it'll be the end of September that was offsetting the cost of our daytime mobile crisis team. For any, we are billing for all of the, all of the visits that we've had. But it's not enough to cover the cost of the program. And I think a lot of people have been vocal about that across all mobile crisis providers that have been doing it for a long time. So OMH did say yes to additional state aid. So we'll be getting to cover the last quarter of this year, which will be about, I think it's like $34,000 or so. And then annually, we will receive the full ask that we asked for to cover the cost, which will be another $138,000 annually to offset the cost of mobile crisis. We'll continue to bill and obviously, that's first and then the state aid is next. So it's deficit funding, but I'm happy with that as well. So that's additional state aid that will cover that program. So.
And that, in your opinion, has certainly reduced the
Oh,
need
yeah.
for emergency room shows and law enforcement escorts and waiting there and.
Yeah, I mean, I could get the data for you. I think it would be really cool to see that, majority of the calls, the person is not going to the hospital. And usually in the first, if law enforcement's calling in the first couple of minutes, the social worker really knows whether, kind of which direction they're going and law enforcement usually can just leave. So it frees them up. They don't have to stay there for the entire call or bring them to the hospital and sit there for hours with them in the emergency room. And sometimes they're just, discharged too. So after all of that. So yes, I think it has, definitely decreased, the ER presentations for people when it's unnecessary. Just trying to think of. And, I did talk to our billing department today. We do get an enhanced rate for our, because we're a county clinic. It's interesting how they do it. Like, we were supposed to start, the rates went into effect last October. You just don't know when you're actually going to get the payment for it. It is retroactive though. I think we received one of the payments. We're still not up to the full 8.5% that we are supposed to be at by participating in their OMH's quality improvement projects. So we're not at the full 8.5% either. So that's not also reflected in this as well. Also private insurance companies are supposed to pay, the Medicaid rate now, that just started to happen and not all of the insurance companies are doing that. So that's also not reflected.
They were refusing to pay it all because I don't think.
They were it was a whole thing about, I think they were kind of dragging their feet as far as doing that, but it is mandated that they are supposed to be doing that as, I think should be in effect as of now. So I know Blue Cross Blue Shield is one that Michelle in our billing department said we just started receiving. They have been paying the Medicaid rate, but not all of them have been doing that. So I do think, because we've been down staff, I think that does play a role in, our revenue that we bring in. So I'm very hopeful. We have a new social worker starting next Monday. We have, talked to you about our billing department. We have a person, she just graduated. We're waiting for her to get licensed and she will start as a social worker. And another person pending approval of a resolution, hopefully in August. She would be able to start in September. So we would only have one open position at the end of that. So I'm very hopeful that will also be very helpful when it comes to our revenue. Yes.
So that means that the school-related satellite clinics would then be essentially full if you can get these folks on board as planned. And those visits are 125%.
Right. So we have two current satellites right now that we're operating, one at Union Springs, one at Weedsport. They are full. at this, like the satellite for the amount of time that they're at the school, they are full. And if the school can provide additional referrals, then our social workers will then have more time dedicated to be able to see all the needed people at the school, if that makes sense. We are in the process of applying for the satellite for Moravia. That's a process with OMH to become licensed, to receive an operating license to be able to do that. So that is not in place as of now. That is unrelated to the SAMHSA grant school stuff that we're doing, just to kind of clarify that.
And you'll get doctor's orders, you'll do consent from the parents, and you'll treat their children who have a diagnosis warning treatment at the school and bill like it was.
It'll be the same, it's the same exact, it's a satellite of our clinic. It's just an extension of the clinic that we do everything exactly the same. Consents, paperwork, same intake process, and they'll be seen just more conveniently at the school versus driving all the way to the clinic. And yes, there is an enhanced rate. There's also, OMH has identified schools that are high need school districts. And Moravia is one of them. I know we were also having some talks around Cato because that's the other school district that we're in. That we get, there's some startup funds associated with starting satellites at those school districts as well. If they're identified as high need. So Moravia is the definite that we're applying for that. I'm not sure about Cato, or Port Barron had also mentioned it, so. Yep. Those are the main points. I don't know if anybody has specific questions or was asked.
Lauren, I commend you on your crisis program. Would you just go over the hours?
Yeah, so it's 8:30, 9-ish, I would say in the morning, till we close at 5.
So 24-hour service, is that only weekend only? No.
So our clinic operates the daytime team. And then we have a regional contract through the regional DCSs. So Director of Community Services have a regional contract to do the after hours mobile crisis contract. So that goes from 5 PM to midnight on the weekdays and then 6 AM to midnight on the weekends. So we don't have any overnight coverage for mobile crisis, but I know Elaine had asked me about that too, but we just didn't see the volume of calls that were coming in mental health related where it would make sense because the expense would be so much to cover the overnight hours. So there's some other, resources for people and during those hours of the night, but those are that. Thank you. Thank you.
Okay. Yep. Any other questions for Lauren? Okay, thank you, Lauren. Thank you. That's the last one. Well, Lynn and Grace are actually last,
All
but
right.
yes, the
Yes.
cleanup crew. Yeah.
I'm passing out a printout of our budget that Roseland put together for us, which has a few notes, and we'll be working off these pages. I'll just identify it as we.
Next time, sit over there.
Sorry.
It's kind of deliberate. It was a little deliberate in the position itself. All right, we'll start right on page 1 on cover. So the number is in the lower right corner. So our health department revenues are about where we anticipate for our clinic fees, which is primarily immunization clinic, right? And our environmental health fees, which a lot of them are like restaurant permits and consent order payments. If you go to page 2, you'll see way through 43,401 state aid. We have received some state aid revenue so far. We received the last quarter, the fourth quarter of 2024, and the first quarter of 2025. And that first quarter of 2025 was fully under the base grant. We have approximately $230,000 remaining in the base grant that we expect will be fully claimed when we send in our second quarter state aid. And then we will switch to that 36% on the dollar. Rabies reimbursement, we've received some. Health Department expenses now, you'll see that in bigger letters. We've got salaries, which are a little less due to vacancies, and also, we have grants that offset some salary costs. On page 3, payroll-related expenses. They're all really what we would anticipate. If you go down to 51,003 salaries overtime, we're at 57%. We expect there'll be some increase over this next quarter because this is the time of year, for instance, that our environmental health staff do a lot of overtime. And we are at half staff for our environmental health staff at this point in time. So they're really taking on quite a bit. As we go down to 51,007, the sick personal time, as per agreements, with the county in 2024, there was the payout for the sick and personal time as per their contracts. It was done in June. So we don't expect any other movement on that line. We go to page 4. There's payroll related expenses, which are in keeping with what we would anticipate. We'll switch over to page 5 for our public health employees, retiree health insurance. It's blacked out because it had people's names on there. But that's right where we would anticipate it should be. Health Department expenses, we do still have the car, and now I'm on page 6, the top of page 6. Which I know there's an assessment being made regarding vehicles. We have at 54,006 audit charge. Our finance department really lets us know what that amount is in the fall, and then, so we budget what we anticipate it should be. Continue on, everything else is kind of typical. We're on page 7. Equipment rentals, midway at the 54,046. It's where we think it should be. It's our equipment rental is copiers. And we put that in our budget, and then we offset what we can through some of our grant funds. The same with 54,049 office supplies. We haven't touched that yet because we are trying to maximize grant funding that we have. The next line down, 54,052 medical and nursing supplies. We again are trying to take what we can out of our grant, our public health emergency preparedness grant for nursing supplies and clinic supplies. So we haven't hit our budgeted line very much yet. We do anticipate there will likely be a change to that particular grant. I mentioned this at HHS committee. We know that the federal government has said that there will be grants continuing on this. It's a lesser amount. These grants go to the states. Then the states in New York State, they've passed it, some of it along to our local health departments. So we don't yet know how that will impact us. At the bottom of page 7, 54,055 postage, we're definitely going to max out on that, and we're going to go over in that line. That's primarily due to early intervention mailings that need to be done. We're working toward trying to do as much electronically in that way as we can, so that we can slow down how much we're spending there. It's mostly early intervention mailings and certified mailings that are required for some of the work that we do. It asked you, once you go over that line, then you'll look within your budget to move money into that line if so needed. Correct, we will. So for instance, something that Rosalind's been doing routinely since the last time we had this meeting, we tapped out of our rabies line. So she's been taking out of our professional services. We had put our performance incentive money, that was extra money that we worked for and received from the state. And she's been using that to offset some of our rabies costs. So we would do the same for postage. Yeah. And if there were, as we go along, if there's additional need to transfer money, if it's something that requires a resolution, obviously we'll bring that forward through committee. On page 8, prescriptions and drugs, that's really our vaccines. We're on target there. Professional dues, those expenses are primarily incurred in the fall. We're on target there. Professional services. We anticipate some bills, some big bills that haven't hit us yet. You'll see that in the third quarter when we do this payment. On page 9, looking at 54075 telephone, that's our Ring Central, which was a cost, right, that's hit the budget, and also language line. No. You like it? Yeah, it's fine. I mean, like everything, it takes getting used to, right, when it's new software. But we don't have any complaints. We anticipate language line may continue. There's, it's just nature of our community, right? We don't have any bilingual staff members, and it's Spanish and other languages at time. Bottom of the page, travel out of county, it's on target. Page 10, looking at telephone answering service 54111. That is something that we need to have 24/7, be able to answer the phones. And currently we are utilizing our funding through our public health emergency preparedness grant to cover that cost as well. So we go down to the bottom of the page, rabies. So we just talked about rabies. I talked about it last quarter. We've blown up, we're done beyond that in our budget line. And so we've been transferring some money from our professional services line into rabies to pay those bills. It is something that is, we claim state aid where we can also, but. And this is the cost of medical providers who actually administer the rabies vaccines to patients who are deemed by Dr. Archer to be in need. So it's medical costs, but it also can be the cost for whoever's helping capture and submit, and are mailing the specimens and things like that. STIs, where we think they should be on page 11, drug testing for employees, we'll tap out of that line also on page 11, assuming we are able to fill some positions. Page 12, we're getting into the Certified Home Health Agency. That's what CHA stands for. We no longer have the Certified Home Health Agency, but there are retirees who are receiving health insurance. So we track that. Then we have grants, and I'm just going to kind of not even go over the grants. We maximize that. There are portions of things that go to offset salaries. We use it to pay for program expenses that are appropriate, and other office-based expenses and utilities. So I'm going to skip over to page 21, because between page 12 and 21, it's all grants. If you have particular questions, we're glad to respond to those. So on page 21, we're starting with early intervention. The EI Medicaid revenue, that's where we would anticipate it should be 43,403, the state aid for early intervention. It's for it's quarterly claims for administrative work. It's a funding stream that our social service agency receives. They can claim Medicaid revenue for early intervention expenses, and in turn pass that revenue to the health department after we submit our report to them. It's only for the children receiving early intervention services who have Medicaid. At line 43,444, state aid early intervention. This is the 49% reimbursement of what we pay for non-Medicaid children. New York State generates their early intervention service claiming for health department reimbursement on their own schedule. And I'm really glad that Rosen wrote this down, because we haven't been paid since last year. We've submitted everything that we can. We're up to date with our submissions. We have, and that's kind of done through our escrow payments that we have to do every month. And then the New York State pays the providers, and we're waiting for the 49% reimbursement and kind of get it when we get it. Wow. And the system was not performing well, and so you guys, the county didn't get their money? Probably part of it, but I think,
Wow.
The longer you can hold on to it, the longer it's in your own pocket. Right. Page 22, we'll get into our preschool special education program. Our Medicaid revenue is really what we anticipate. The county administrative costs, this is similar to what I just said about getting our reimbursement from the state for early intervention. The county administrative costs are the claims and the automatic voucher listings. We've submitted all of that. The payments are scheduled by the state education department. And they send it to us when they send it to us. So we have not been paid for that yet. The expenses and revenues, though, that applied in 2024. See, I was laughing when I'm going over this with Rosalind. I'm like, you're talking accounting talk here. Expenses and revenues applied to 2024 have been accrued and claimed for 2024. They will not be reflected in the 2025 budget here. So much of the revenues received in 2025 were for last year's services. Okay, I'll go to the next page. Preschool expenses and salaries, what we would anticipate and benefits associated with them. Same when we look at the health insurance on page 24. Now I'm going to skip over from page 24 over to page 29 because the way this report prints, this is all EMS related stuff on pages 25 through 29. Then we get to our WIC grant, which we budget out separately. WIC is covering its expenses. And as we. Yes, and before you go
Yes.
to WIC, when we met, Rosalind, I thought confirmed that you're talking about early intervention, 0 to 3 kids. The county's local share for that program, after all said and done, if we ever get paid, is not that great. $80,000, did you say?
I would have to
Right,
get
but
the numbers, but the net effect, yes.
not anywhere compared to 3 to
Oh, no.
3 to 5.
Yeah.
You told me that the county has to budget $4 million in expenses to pay for this program.
Right.
That is bigger than, twice as big as your health department budget. Is that?
Yeah.
Yeah. I mean,
So-
that's where the pressures come.
That absolutely, it's by far the most expensive. It's the tuition, it's the transportation.
We do
It's
get
a pain.
59.5% back,
Uh-huh.
59.5%. But
Was it 90%?
59.5.
59.
And we do get some Medicaid reimbursement as well.
Mhm.
They're really good. And Rosalind gets a tremendous amount of credit. She's worked in this program for years and she knows the details. So even when we went to McGinnis, which is our software program, there are areas that look for the AVLs, have them ready because that's going to open up shortly. So we're ready for them and you can submit because it's really who's ever first in the queue gets paid first when it comes to something like that. So that really helps us as a county. And as we talked about, I think all of you know at this point in time, the 3 to 5 program, it's a mandate from New York State through State Education Department that the county operates. It doesn't have to be a health department program, but it's like the logical placement that it's within the health department because we do the early intervention.
And if that's the high pressure area, you don't know whether or not you'll go over in that line. It's too early to tell. Or you could.
It
be
is too
going
early
over.
because with the new school year, it's always things change.
Yeah.
The transportation changes. So it's kind of hard. We sort of try to look ahead. We try to
Yep, project out,
but there's
There-
always unpredictable things that can happen.
There's a new tuition-based school that opened in Camillus, and we have at least 4 or 5 children going to school there, which is great because they're receiving services and they qualified for a tuition-based program. But it means we're going to be paying tuition for 4 or 5 more students who might otherwise not have not have been receiving services when they should have, or only getting the little bit of service that might have been available to come to them.
and transport for that.
And there's the transportation in addition to that, correct? And we are, we talked about this also when we had our budget meeting with you and Heidi and Jonathan. We try to work really well with the parents to encourage them to transport their child and we can reimburse them for that cost, which is tremendously less expensive than taking a bus. But that's something we're always looking at. And the transportation is tricky. It's not just to one place anymore. There's like 6 different preschools that we transport people to out of the county. It's a complicated process. So anyways, our WIC program, I don't know that there's anything outstanding there, except we can, identify that we do
try to cover all of our costs, but also where we can have some funding to offset retiree health insurance, which we have about $97,000 budgeted to do that. Okay. We brought it to our last, I know it's just been mentioned in some of the discussions earlier. Again, Rosalind and her staff put together a list of our vacancies from 2024 and 2025. Right now, we have 3 vacancies in the department. And then we talked about some of our anticipated needs, but.
Going back to WIC a little bit.
Yeah.
WIC is a federally funded program, correct?
It is.
We expecting next year to see cuts there?
That's the big question, right? It's about, I want to say about 83% of the program is federal funds and then the rest be state. We're holding our breath. We have not heard that it's going to be cut. It's not popular to cut support to women and babies, but I don't know. We don't know yet.
Are popular these days.
Right. Right. So, yeah,
They don't care about.
Truth, right? It's true. But, yeah, so a lot of these, we're very fortunate that we have, a state organization who's very attuned to paying attention to a lot of the federal changes, and they work with so there's the New York State Association of County Health Officials, NICHO, that you've heard me speak about, and then there's NACHO, the National Association of County Health Officials. And we are members, by our membership through NICHO, we are members of NACHO, and they work very closely. So the national one is really paying attention closely and doing a lot of analysis. And then, of course, the New York one is saying, what does this mean for New York State? Because there's not a lot of love lost between the federal government and New York State. So there's going to be impact, right? And so as we know it, we try to share it, and we're trying to anticipate what we'll do.
I think a lot of it, WIC isn't in the farm program grants or whatever, but they've already cut out a lot of the SNAP education.
Right.
So I'm kind of guessing that a lot of those portions of WIC are probably also going to be slashed.
So we had a contract with Cooperative Extension who was going to do some SNAP education for us, and we'll be able to do the August or September session, and then void. Yeah.
They haven't cut the funding for the actual program yet.
WIC goes on the federal year, so I would anticipate that we'll hear within the next couple months if that's the case.
Oh, it starts in October.
It starts October 1st.
Year of the WIC grant, 5-year are you in?
I'd have to look. I probably have it. I don't know where we're at right now. Is it? Do you recall?
I can't say for certain.
It's 3 going into 4. Going into 4. Thanks.
Any questions for Kathleen? Thank you.
Great.
Thank you. It's all good. It's all good.
Everybody?
Hello.
Yes, we're still here.
Yeah. So mine is short, so all the departments kind of went over, so I didn't want to be redundant and go over a lot of those areas again. So I just really want to go over a couple of our larger revenue accounts that are in the finance, some in the finance and some not, but the main one obviously is our sales tax revenue. We always like to look at. I did send out the sales tax through June, and the last couple of months, as you could see, we're pretty flat to last year. So we're assuming right now that it will remain flat for the rest of the year. With that being said, if that happens, we would be under budget in sales tax by approximately 900,000. Now, last year, around this time, we were saying the same thing and we did, come back quite a bit. But until we see those numbers, it's, I would rather anticipate staying flat until we don't, so.
Autumn is definitely a higher buying
Yeah,
season
yeah.
between school and the holidays.
Yeah. The next one is the interest earnings. I do have some attachments, that kind of, they don't really, just shows it a little bit more. But, we budgeted about 1.1 million for interest earnings. We are anticipating, that to be over by about 250,000. I'm actually anticipating it to be over a little bit more than that, but, some of this money does go to the capital reserves or to the reserves. So it really doesn't affect the fund balance per se, but it does affect the amount of money that's sitting in our reserves. So I'm projecting about 250,000 that would offset, the sales tax loss. I did look at, because, Lloyd doesn't do a presentation, I did look at the Public Defender Side Council. And I did email him, and it does look like we're projecting to be over budget by approximately 100,000. I'm not sure if there will be any additional revenue. I think it really depends on the type of cases and so forth. So at this point, though, if that happens, he will obviously have to come with a resolution to ask for money out of the fund balance on that. And then I did look at just a couple accounts just to kind of make you aware. The economic development, there is an available budget in there of 150,000. I just wanted to bring your attention that it is in there.
Hasn't been
It
spent.
hasn't been spent.
Okay.
Yeah. And then currently our contingent account was budgeted 200,000. It has available budget of 195. I believe there is a resolution for about 8,000 for probation in July, so it will be reduced by that. So there's still, if that passes, there's still about 180-something thousand in that. And then the last page, I did want to give you an update on where we were with the reserve balances. And as you can see there, you can see the interest there. That does increase those balances. So we do work really hard with keeping everything in, obviously, those high interest bearing accounts. We have had to pull some. I know Dave gets mad, but we got those to pay. So, but we are trying to earn as much interest. I mean, that's the one area that we can really try, again, I've said before, try to move money literally the day I need it to try to earn as much right to the day, There are a few other revenue accounts in the finance department, our OTB revenue, our drug subsidy. Those are bigger accounts, and I did look at those, and those I didn't report here, but they look to be on budget. So, it doesn't look like we're going to be over or under at this point. So I didn't put them in here.
Where does the tobacco?
That's a whole
Separate.
Yeah.
That was part of the tobacco securitization we had to go through, and there are some funds there, but there's expenses paid out of them as well.
Correct. Yep. That's a bank account specifically for the Tobacco Asset Corporation. Yep.
And the last page is the current reserves.
That's your current reserves. Yep. So you can see we still have about $1 million in building repair, or 890,000. Our building capital, we have about 4.6 million. Our highway repair, we still have about 2.7 million. And then the other ones are just some smaller ones that, Emerson Park, Sterling Nature Center, Stop DWI, DARE. So those, we do use some, but we do increase the balances, like I said, as we earn interest on them.
And the money from OTB goes right into the general,
Yeah, we budget for it.
Oh, okay.
Yeah, so it's part of the budget. It offsets the budget.
Grace? All right, thanks. And then Lynn, you want to say a few things?
The only thing I had looked at in addition was I was looking at the 63 Genesee, a lot of the expenses, and you know, we had budgeted some funds last year that we didn't use. We did a resolution, then we budgeted things. So I was just doing some projections out on those, and I mean, I think we still have a good 300,000 that's not really accounted for. So that also could be used if we have something come up, you know, between now and the end of the year, that we can do a resolution to use those funds. If not, it'll be unspent, but sometimes I'm asked to ask for money to find it, so we won't spend all that, I don't think. I do think while we're working on the budget, we might bring some resolutions. It's one thing we've been talking about is we're gonna, you know, tell departments more that they need to do resolutions if they're gonna be over budget in September, October, if they're not over yet, and try and, you know, get people to do that more, and then you'll be more aware of what's going on. But we really have to tell departments that they're responsible for monitoring their budgets. We wouldn't bring a resolution to amend their budget. It's the department that needs to do that. But we will talk about that when we're working on a budget to remind people, because that's when people are projecting out. You know, they might not be over yet. And, you know, oh, I'm gonna go over in November, and then kind of the year gets away from you, and next thing you know, there's no meeting anymore and the year just ends. So that kind of happens, you know, we have that meeting quickly in December, before the month's even close to being done, so. And then we accrue expenses, we have all these expenses, don't get paid till January, and they actually go in the current year, so try and maybe work on that a little bit better, doing a better job at that with people.
So why, when some departments go over budget, we transfer money and we have a resolution, but when other departments go over budget, we don't do anything?
Well, I think the mechanism, I'm not gonna give you any logical justification for that, but you can't put a purchase order in munis if there's no money. But the finance department can always post a journal entry. That's just like the way the computer system works, okay? Like that's just literally, you cannot type it in if there's no money in the account, it stops you. But the finance department can do it. I said, most people aren't gonna go over till it's November or December, and we're gonna accrue expenses if you have no money or not, because for accounting regulations, we have to accrue the expense. So I don't really care if you don't have a budget when it's December, right? And we usually have to do that. A lot of people have bills for services for November and December, they pay them in January, they get accrued against the prior year. So when you look at the reports at the end, you're gonna be like, oh, they went over budget. Yep. Because you can't not follow the accounting regulations.
That is a decision that the county legislature has to make, as to notifying if there's a department that goes over budget. Some accounts you can move money without a resolution.
0.4.
Yeah,
Yes.
they're small amounts,
Right.
and usually these are bigger problems we're talking about, not that
Yes.
anybody has the money in their budget that they can small things, people do that. We have routinely $100 here, 500 here, 1,000 there. People do that, and we don't need to tell you because our policy allows us to do that with the small amounts. People can do that.
But when you were gonna try to pay the 730s and you needed $1.2 million in that line, there's no way to say, well, find it in your budget and move it in there. I mean,
Right.
those large expenses, and
even if she had the money and could move it, because it's so large, she would still have to come with a resolution because it exceeds.
But I think your point is if departments go over in salary or overtime and they run out of money, then it's up to us to say what we want done about that. We want a resolution brought and advance notice, and if we do, then we say it, and if we don't, it's kind of the way it's been, especially in the salary and overtime line.
Right. That one becomes difficult, obviously, because payroll doesn't run through Munis, right? So
Right.
people are working it, and then, we get the timesheets and payroll has to pay the payroll, and then we book it with a journal entry into Munis. That's how it goes into Munis, but it's kind of after the fact, right? I mean, we're paying for people that have already been working.
and, you know, not to get into doom and gloom, but I think, Lynn, you said as we were going to talk about the exceeding the tax cap, and we decided to table it because we wanted to get later on in the year, and the tax cap, it was potentially 2.6% or 2.7, that the best idea you have. And that's an arbitrary number that's now set by New York State. But you said some sobering things, that if health insurance, if we stay under the tax cap, and these are the decisions we have to make, and we say we'll only tax up to the 2.6, you told us that that was only $1.2 million in revenue, additional revenue coming into the county. Health insurance alone is up by 2 million.
It could be. I mean, we don't have the rates yet, but we're having a very bad year again. The rates are gonna go up a lot. So 15%, that's another $2 million that the county would cost the county.
If we gave everyone across the county 3% raise, and God only knows, that would be over
1.3 million.
over what we would. So, I mean, that's, I think the real issues have to be, how are we going to get an operating budget together that doesn't deplete the fund balance?
I mean, it's almost impossible.
That preserves services without.
We don't want to raise the taxes, but I don't know how you can even think you're gonna do it without having a draconian budget where departments are just completely cut. I mean, you just heard it could be $500,000 that we won't receive in revenue for food stamps, when we're gonna get a double mandate to be doing more work with them to do their employment, and we have to pay, you have to pay people to do it, or you know, I don't know, we're not gonna be in compliance with that. There's lots of worries about what's gonna happen with Medicaid when the state loses $2 to $3 billion. I mean, we can't pretend that something's not gonna get cut to New York State. This happened in 08 and 09, DSS lost fundings. That's when we went from, we used to have 50% reimbursement on administration for safety net and program. No reimbursement on administration, and then 27% never came back, never got it back, right? Never got it back. We lost money in preventive services, so that's what will end up happening. They're gonna take the money from things that don't kind of get the headlines in the paper to the counties, and it just kind of happens. And it makes its way through, you know? So I mean, I think we just have to be realistic, even with making cuts of some staff and some services, and you're not gonna be able to go over that number.
And
Have any carryover from prior years. I mean, we raised the taxes in 3%, 4% the last couple of years. It was under it.
And there used to be incentives if you stayed under the tax cap and all that. That's all gone.
No, there still is. I mean, you can claim a hardship, like the raise the age reimbursement you won't get if you don't stay under it. That's definitely one of them. I don't know if there's actually something else. It is definitely the raise the age. We have to have that certification. But they actually let you fill out a form for this fiscal hardship, and counties have done it. And they've still paid them.
And I thought you had said that there are a number of counties that in the beginning of the year, just bring the resolution and to go over it, because they're not going to be obligated to
by New York State telling them what to do. And they did that as soon as it had come out years ago. They started doing it, because you end up in this awkward position that we're kind of in. And it should be, you get to make your own decisions here. And I said, even if you want to raise the tax 3%, doesn't matter if it's only 0.02%. If it's over, it's over.
And then it's in a deferred one. What did you say? It goes in.
You actually levy the taxes. If somehow the budget passes that way, you have to take those funds in a reserve. You can't use them. So.
Okay. All right, thank you.
You.
Thanks, everybody. Long meeting, but thanks.
Well done. Thank you.
Motion to adjourn.
All in favor?
Aye.